There's an easy way to protect yourself and those you love from COVID-19. Get vaccinated.
Here's what we know about the vaccines.
They're safe. Serious side effects are extremely rare.
They have one job. They kick your immune system into gear, then they leave your body.
They're effective. They provide outstanding protection against serious illness.
Listen to the local doctors you trust.
Let's strive for a 75% vaccination rate.
Do your part.
Reconsider.
Get the shot.
Good morning. I want to welcome you to our press briefing with updates on COVID-19. As we begin our press conference this morning, please join me in a moment of silence for the lives we've lost and thank you. Now we will hear updates from our community leaders, and first we'll hear from the chairman of the Dougherty County Commission, Christopher Cohilas. Mr. Chair.
Thank you, Chief. Today I'm going to be fairly brief. I want to thank the community for truly getting behind our vaccination efforts. Several weeks ago, we came here and we were talking about how horrible things were looking at the hospital and how many people were on respirators and how many people were sick and were dying. And we were experiencing, again, tremendously bad numbers and tremendous numbers of deaths and unfortunate and completely preventable deaths. And I just want to thank the community for stepping up and getting the vaccination. We've had very good response to our vaccination efforts and our vaccination drives. Our Strive for 75 campaign has gone extremely well. I want to thank all of the members of the Emergency Management Agency. I want to thank Phoebe. I want to thank all of our first responders. I want to thank the county staff, county administration, the Department of Public Health for putting together these two events that have already vaccinated well over 1,000 people. In fact, at our last event, we had 875 people that were vaccinated. And so when you start to think about that for a second, 875 people that are far less likely to get the virus, far less likely to spread the virus, far less likely to end up in the hospital, far less likely to die. And that's a tremendous impact here in our community. And then when you start to think about the number of people that can be infected by one person and the number of people that are infected by that person that then can infect other people, and reducing that number exponentially has had a profound impact. And you're going to hear today about how our numbers are looking so much better here in this community, where we're having less people in the hospital, less people on respirators, less people that are dying. And that is literally what being mindful and doing the right thing for our community has resulted in. And that's, I'm very thankful for that, very thankful for all the people that have worked together to make sure that that has happened. Again, we have many resources here in our community. We've talked about it ad nauseum. We've talked about the testing. We talked about the vaccines. We talked about the booster shots that are available for so many people. And those are very, very valuable tools that continue to help us to protect our community, and frankly also to be able to move around more freely so that we can actually have more confidence when we have our interactions. And I'm going to just say this. We went through Thanksgiving and the holidays last year, and I stood here and we talked about what could happen. And last year, before we had the resources that we have here today, when we didn't have a vaccine that was readily available, when we didn't have all the other things that we know help us, we watched the numbers spike. We watched the number of people on respirators spike. We watched the number of people dying spike. And if you do anything for your family, I know people are going to come together and gather, but please make sure you're vaccinated before you sit down at the Thanksgiving dinner table and share time with family. It's just incredibly important, because I don't want to experience what we experienced last year. And let's learn from the past. Let's not repeat it. Let's define our own future. Additionally, the county is going to be considering some additional efforts. We're determining right now whether or not it's going to be feasible for us to do another vaccination drive on November 6th. That has not yet been determined. We'll be determining that probably on Monday at the Dougherty County Commission meeting. So more information will follow with respect to that. But please take the time now to get vaccinated well in advance of Thanksgiving, well in advance before you're sitting down at the dinner table with family and friends. And people, a lot of times, we know this, we have a lot of folks in our community that are vulnerable, and they are a lot of times our most beloved family members that are going to sit with us at Thanksgiving. So let's take those steps that are necessary to protect ourselves and those that we love. Thank you.
Thank you, Mr. Chairman, for your remarks today. We will now move to hear from our partners at Phoebe Putnam Memorial Hospital. Fortunate to have with us today the Chairman of the Emergency Department, Dr. James Black, for some comments.
Thank you and good morning. Today we're caring for 41 COVID patients in our throughout our health system, and that includes 32 in Albany, 8 in Sumter, and 1 in Worth County. That represents a decrease of 81% since our peak in August, and a decline of 29% since last Friday. We're very grateful and thankful for that decrease. Still have a ways to go, but certainly down from our peak. We're not nearly at our low that we experienced a couple months ago when we were in the single digits of 8, but we hope to continue to see to push that number down. Our critical care numbers remain pretty steady. We have 15 people in our critical care units. Of those, 12 are on ventilators. Unfortunately, since our news conference last Friday, we have lost 5 patients to COVID. 5 patients have died. Since the surge began in July, we've admitted 1,041 COVID patients. Average age of those patients during the surge is 56, and that number is decidedly lower than it was in previous surges. Since that time, 15%, since July 15th, 52% of our hospitalized patients have been women, 49% African American, 47% Caucasian. As of yesterday, 88% of the hospitalized patients with COVID were unvaccinated. We've reached a vaccination milestone in the state of Georgia, finally crossing the 50% threshold. And while we're happy to see that continued steady rise, we still lag behind the national average. And here in Dougherty County, we actually lag behind the state average, where our residents are at 45% are fully vaccinated. And we'd like to see that number increase again. We're striving to see the number get to 75 if we can, so we're going to continue to push those efforts if we can. We really ought to get and need to get those numbers up in order to prevent another surge. I'd like to remind you, you can schedule an appointment for your initial or your booster vaccinations by calling 312-MyMD or 229-312-6963. You can also check out the upcoming schedule for our mobile units that are going to be out in the community, and appointments are not necessary. You go to phoebehealth.com/mobile-wellness. You probably saw in the news that the FDA and the CDC and our Georgia Department of Health have now all approved shots for people who received the Moderna and Johnson & Johnson vaccinations. Next Tuesday through Thursday, we will hold and operate a mass vaccination site in Americus for people who need a Moderna booster. The vast majority of the initial doses that were given in Albany in this area were administered by Phoebe with the Pfizer vaccine, and we've already completed max vaccination for those folks. Again, if you're eligible for your booster shot and needing to get that Pfizer, you can call 229-312-MyMD. For the Moderna, and just to give you the qualifications, if you're eligible for a booster for Moderna, if you're at least 65, or if you're at least 18 years old and have live in a long-term care facility, have an underlying medical condition, or otherwise at high risk of COVID exposure at work. and you can receive your second dose of Moderna at least 6 months if you received your initial vaccination at least 6 months ago. Our partners at AAPHC, our Albany Area Primary Health Care, administered a lot of Moderna vaccine, and we will work on them on a mass vaccination booster site. So the plan is for AAPHC to provide those shots at Phoebe East over the next couple of Wednesdays. Again, you can go to aaphc.org or call AAPHC for more information. Again, if you need information on any of that and you're unsure, just call 312-MyMD, and we'll help you out. Johnson & Johnson has also been approved, and now those boosters are available for those that are over 18 years of age and qualified. It is likely that the emergency use authorization will be granted for children ages 5 to 11 shortly, and we're working on a plan to ensure we can provide vaccinations to that age group when that becomes, as soon as it's approved. Also, don't forget, we're in flu season. We're seeing a lot of influenza now. So in addition to getting vaccinated for COVID, we need to make sure that you get vaccinated for influenza as well. Please don't delay getting that flu shot. We're seeing a spike in the numbers already. This week at Phoebe, we're able to resume our full surgical schedule. You may remember back in August, in order to accommodate the large number of COVID patients we were getting, we suspended all the non-urgent surgical procedures to free up bed space and staff and allow surgical staff to help transition to help with our COVID response. Since the numbers have been coming down gradually, we've gradually turned on more and more of those services, and we're back to operating a full surgical schedule. We also want you to know that all our clinics are open and operating at full capacity. Now, we regret that the suspension of services may have caused a delay in some of our ability to treat some of those patients, but we certainly hope you understand the reasons why it was necessary in order for us to provide care for the community. If you, and hopefully you didn't, but if you did put off any of those healthcare needs, I urge you to go ahead and make those appointments and get those appointments out of the way. Again, all of our clinics, operating room, we're operating at full capacity now, so make sure you don't delay any of your necessary healthcare. Tomorrow, Phoebe is going to host our annual Women's Health Fair. It's going to be a drive-through event that will be held at Albany State University's West Campus from 8 a.m. to noon. Flu shots, fresh produce, and goodie bags will be provided. V101.7 will broadcast live so women can tune in radios to the station as they do the drive-through, or you can listen from wherever you are to hear important health information from Phoebe caregivers, and we hope to see you there. Again, remember to wear your masks, wash your hands, maintain social distancing, and if you have hesitated or delayed getting your vaccination and deciding to get that, let's go ahead and schedule that and don't delay it any longer. Thank you and stay safe.
Thank you, Dr. Black, for your comments and update today. We'll next hear from our partners at the Department of Public Health. Camilla Lovett, who is the county nurse manager for the Dougherty County Health Department, is here with us today. I'd like to ask Ms. Lovett to come forward for some comments.
Good morning. I'd like to start off with the percentage of the county residents who are fully vaccinated and partially vaccinated. And as we strive to reach 75% by New Year's Day, we are now 50% who have had at least one dose, and 45% of our residents have been fully vaccinated. So that's good. We are at 45%, and we are striving to get to at least 75% by January 1st. So please, if you haven't had your vaccine yet, be a part of that percentage that will help us get to 75% by January 1st. We are continuing to offer all 3 vaccines at the Dougherty County Health Department: Pfizer, Moderna, and Johnson & Johnson. And as most of you probably know, all 3 vaccines have been approved. All 3 boosters have been approved. And for individuals who received the Pfizer and the Moderna vaccine, the following groups are eligible for a booster shot at 6 months or more: after their initial series. Those who are 65 and older, age 18 and older who live in long-term care settings, and those 18 who have underlying medical conditions, and those 18 and above who work or live in high-risk settings. For the nearly 15 million people who got the Johnson & Johnson COVID-19 vaccine, booster shots are now recommended for those who are 18 and older and who were vaccinated 2 or more months ago. There are now boosters recommended for all 3 available COVID-19 vaccines in the United States. Eligible individuals may choose which vaccine they receive as a booster dose. Some may have a preference for the vaccine type that they originally received, and others may prefer to get a different booster. The CDC's recommendations now allow for this type of mix and match dosing for booster shots. Millions of people are newly eligible to receive a booster shot and will benefit from additional protection. And examples of workers who may get booster shots, first responders, for example, healthcare workers, firefighters, police, congregate care staff, education staff, teachers, support staff, daycare workers, food and agricultural workers, manufacturing workers, corrections workers, U.S. Postal Service workers, public transit workers, and grocery store workers. And the list could be updated in the future. As we're learning more about COVID-19 every day, this list does not include all medical conditions that place a person at higher risk. And some of the medical conditions of individuals who can get the boosters now, someone with cancer, chronic kidney disease, chronic liver disease, chronic lung diseases, dementia or other neurological conditions, diabetes, type 1 or 2, heart conditions, HIV. These vaccines are available now Mondays, Wednesdays, and Thursdays, 8 a.m. to 12 o'clock noon, and on Tuesdays from 1 to 5 o'clock. That's Mondays, Wednesdays, and Thursdays, 8 a.m. to 12 noon, and Tuesdays, 1 o'clock to 5 o'clock p.m. Appointments are encouraged, but they're not necessary. We're also continuing to do testing at the 1150 West Oak Ridge Drive site. That's 1150 West Oak Ridge Drive. That's Monday through Friday, 9 a.m. to 4 p.m. And on Saturday and Sundays, it moves to the location moves to the Dougherty County Health Department at 1710 South Slappy Boulevard from 9 to 2. So we have testing available still 7 days a week here in this community. Okay. And as always, we would like to encourage you to wear your mask, wash your hands, practice social distancing, and stay at home if you're sick. Thank you.
Ms. Lovett, thank you very much for being here and providing a report from Public Health. We will now hear from a report from our emergency services here in Dougherty County. We have the Director of Dougherty County EMS with us today, Mr. Sam Allen. Come forward, please.
Thank you, Chief. Good morning. We have seen a decrease in the COVID cases. We're averaging between 1 to 2 patients per day, which is very good. I just want to thank all the citizens for coming out on the previous 2 events that we've had for the mass vaccination and getting the vaccination. Please, I encourage you all, if you've not taken the vaccine, please contact any health facility and get scheduled. Thanksgiving and Christmas are just around the corner. Please remember what I was talking about previously, 42 days from the time you take the Pfizer shot until you get your best potential maximum protection. And with the Moderna, it's roughly, I believe, 56 days. So time is of the essence. The holidays are here. Please step up now. Please go get your vaccination, and let's keep January health numbers in a low, very low column. Thank you.
Thank you, Mr. Allen. As we begin to reach the end of our press briefing today, of course, as we continue to remind our citizens about Strive for 75%, it's been talked about today, but we do encourage you to do your part, reconsider, and get the shot. That ends our press briefing today. Have a great weekend. Thank you.
There's an easy way to protect yourself and those you love from COVID-19. Get vaccinated.
Here's what we know about the vaccines.
They're safe. Serious side effects are extremely rare.
They have one job. They kick your immune system into gear, then they leave your body.
They're effective. They provide outstanding protection against serious illness.
Listen to the local doctors you trust.
Let's strive for a 75% vaccination rate.
Do your part.
Reconsider.
Get the shot.